I started Nurse Camp Academy because we are in a shortage. I'm a nurse, been a nurse for about 30 years. So when I look at nursing for my field, my career choice, have the right mentoring here. We really need to be doing is trying to prepare for the long haul. So we have to start younger, and it has been phenomenal to watch. It's just amazing. And I started that mainly because we're not capturing them at the younger age.
I come from a legacy of strength,
I come from a legacy of strength,
wisdom, and resilience.
wisdom, and resilience.
My mind is powerful,
My mind is powerful,
beyond measure.
beyond measure.
My body is capable.
That's the sound of students in Wilmington, North Carolina, reciting an affirmation at the start of a healthcare training session. They're a part of Nurse Camp Academy, a program introducing young people to careers in healthcare, many for the first time. The need for nurses and healthcare workers in Wilmington has never been greater. New Hanover County's growing population is adding to the demand for medical care. While healthcare systems are expanding, there simply aren't enough professionals to meet the need. This innovative program is led by the nonprofit Better is Possible, dedicated to creating opportunities for youth through hands-on learning and mentorship.
Easy, hard, what would it be like?
You just couldn't help other people, or you give them wrong information to help yourself.
All right. If we're at a place where we are doing this thing and we're helping other people, but we're struggling, do you think we'd be given good service? What would it look like?
Bad service.
Bad service. So give me some examples of bad service. Yes, ma'am. Thank you.
Leading the session is Alexa Hunt, one of the Academy's lead trainers. She guides the students through conversations about self-care and emotional well-being, essential skills for future healthcare professionals.
But I think what is happening here with Better is Possible is absolutely necessary. It's something about being able to see things that then you realize you can be. And if you're not exposed to it, you don't even know that it's possible. So when I think about Wilmington as a whole, there are a lot of gaps within the community. And I think with Sabrina having a focus on healthcare and starting it, and I'm going to say even with this class, starting it at a younger age, the more exposure by the time we get to being adults, so we're thinking about these children, they'll be able to see what impact has already happened and what they can do to impact their community.
We spoke with Savan Barrios, the program coordinator for Nurse Camp Academy, to learn about the need for mentoring young people into the healthcare field.
So New Hanover County is growing daily. We have a lot of retirees coming to the area. We have a lot of tourists coming to the area. So we are being flooded with even more people which require more care. Things happen when they get older, they need more support. Our hospitals are currently expanding, trying to meet the need. So we need to have more nurses and more healthcare professionals in the field to take care of that growing need. I think when it comes to healthcare, it is that bedside end of things. They have, I think, the biggest shortage, because as nursing has grown, it has become more diverse, because all healthcare workers are no longer just bedside. You know, they're doing things like education, their social media, teaching.
These programs build confidence, nurture curiosity, and provide hands-on experiences that can set students on a lifelong path in the medical field. For many, this training marks the beginning of a career that directly impacts community health and well-being.
Mentorship is really important so that we can bring to the forefront what is available. We have a lot of young youth, adolescents that just don't think about healthcare. And the reason why they don't think about it is because it's not in their environment. So it's important for us to mentor them, to show them how wonderful it is to be in a career of nursing. They always say, I want to help people, but they don't always know how they want to help people. So if we start exposing them to healthcare careers sooner, we can make them excited and we can give some core memories to them so they will be able to continue to fulfill that journey and do something in healthcare and honestly have a better workforce that's really more dedicated to giving good care to the patients.
In 2024, nurses from across the country testified before Congress, speaking on the urgent challenges facing their profession. From staffing shortages to burnout, their stories highlight a growing crisis in the healthcare system.
As many people have noted, we are in the midst of a genuine crisis in the nursing profession. An estimate from the National Council of State Boards of Nurses suggests that roughly 100,000 nurses have left the profession since 2020. Worse yet, the crisis was not limited to the COVID-19 pandemic. Rather, we are in dire straits. That same study also found that about 20% of current nurses were considering quitting their jobs. As frontline caregivers and nurses, we know that safe staffing is crucial to the health and well-being of our patients and our ability to provide quality, safe patient care. According to the American Nurses Association, nearly 1 of 5 nurses, newly licensed nurses, quits within the first year, often citing stressful working conditions, lack of leadership and supervision, and understaffing.
Here in New Hanover County, those same challenges are felt deeply. With a growing population and expanding healthcare needs, programs like Nurse Camp Academy are taking proactive steps to inspire and train the next generation of healthcare professionals.
Water is generally a thin liquid, right? But depending on the level of their exposure, they have to drink whatever level is ordered as safest for them. So
There's levels of water now?
levels of the thickness of the water.
At Nurse Camp Academy, mentorship is woven into every experience. From speech-language pathologists to radiology technicians, healthcare professionals guide and inspire the students. Sabrina Hickman, the founder of Better is Possible, explains why she launched Nurse Camp Academy and how she hopes it impacts the youth as well as the healthcare field in New Hanover County.
Exposing them to things like, hey, do you know you can be 16 and you could be a certified in first aid, CPR, a coach. You can be a lifeguard. The problem is a lot of kids don't think that they can because it's too much out of their league. It's something big. They just see a teacher, and that's unattainable for them. And I want them to know you can do the same thing. And if you're certified, then you can actually turn around and teach somebody else to do the same thing. We have other nurses who are training and mentoring who have signed up and who've shown up and helped do some of the training. We also have a speech and language pathologist. She did a whole training and we turned into dysphagia bingo, which is difficulty swallowing, and to teach these kids about dysphagia and what all it's about. These are nurses work with speech and language pathologists all the time, and so we were able to tie all that in and they retained it. They even had a post examination. They did it, they passed it. We also did a workshop training where you learn how to feed each other. And then we also went to the nursing home where they got a chance to use some of those skills on live people, help pass out trays and get their food together. So, so we got just different people are coming together. So it's not only nursing, but it's a beautiful thing to see. Hey, they're all coming together. X-ray tech. She said, hey, I would love to be a part of radiology technician. And she said, I'm just passionate about it. And I would like to be able to help. How can I help? I said, okay, you can let them know what radiologists do and, how nurses will interact with them. So we're accepting volunteers, anybody who's wanting to come in and help train, use your gifts. Just at a table last week in a meeting with administrators and medical director and all. And I said, yeah, we had somebody who were young. I think they were 20 or 21. And they just said, I didn't like the way so-and-so talked to me, and they just talked to me kind of horrible. I'm just clocking out. I'm just letting I'm leaving. Like they're just not like, what are you going to do if a patient's having a bad day? We catch it all the time. Not saying that, we want you to be accustomed to abuse, or we're here to help people heal, help them get better. So how can you do that if you can't heal your own wounds? Come and do it. Just if their kid is interested in it, they should definitely come do it. I always say if you are interested in healthcare or nursing, you shouldn't be dropping fries and flipping burgers. You should be in healthcare. So there are plenty of programs that are out there where kids can come in. Back in my days, they had candy stripers. So they probably call it something else now. But you can come in and volunteer, junior volunteer program, or even work. You can actually work there. You can follow instructions. There are opportunities where, like the seniors, let's say the senior living center, they're having a problem maybe getting their writing down their what they want, their orders. So the kids were able to help them on Saturday because we're partnered with Davis Community, Davis Healthcare, and they were able to go there and. After they got their trays passed out, they went ahead and did the menus.
Nurse Camp Academy proves that when young people are given the opportunity and support, they thrive. But sustaining and expanding programs like this takes investment. Workforce development programs not only fill urgent gaps in the healthcare system, they also build resilient local economies. By creating clear pathways into well-paying healthcare jobs, these programs reduce unemployment, increase stability, and ensure better patient care.
So I don't want them to think just because you're young, there's nothing to do. There are so many things that they can do. And I would challenge any healthcare institution or healthcare organization to find ways to incorporate our youth. And if we don't create those programs inside of these organizations, these kids are going to go elsewhere, and they're going to think that it's not cool for them to do or something they can't do until they get older.
If you're interested in supporting programs like Nurse Camp Academy, you can find details in our show notes. For Shoresides, I'm Nick Saberla. Thanks for listening.